So now we are going to see about the sciatic nerve. It is one of the nerve in the lower limb. So yellow color, which you can see here, is the sciatic nerve. So coming to the sciatic nerve, it is the largest and longest nerve of the human body, as it originates from the L4, L5, S1, S2 and S3 nerve roots from the lumbosacral plexus. Coming to its termination in the popliteal fossa, it going to divide into terminal branches, tibial and common peroneal nerve. Coming to the function, it gives motor supplies to the posterior thigh muscles, that is particularly hamstring muscles, and it gives sensory innervation for the lower leg and the foot. Coming to the course, as we saw the origin of it, coming after that it enters into the pelvic region. In pelvic region, it comes to through the greater sciatic foramen and reaches the pelvic region. So in pelvic region, normally there are some structures which enter above the piriformis muscle, below the piriformis muscle. So the sciatic nerve enters below the piriformis muscle. Okay, and in gluteal, after that it enters into gluteal region. Here it lies deep to the ischium and quadratus femoris muscle. As in gluteal region, sciatic nerve does not supply any of the gluteal muscles. Coming after that, it enters into the posterior thigh, that is posterior compartment of it, and here it lies deep to the long of biceps femoris. Okay, and at last in the popliteal fossa, at the upper angle of it, it's going to divide into two terminal branches, as we saw it before, tibial and common peroneal nerve. Coming to the clinical significance, first is the sciatica. It is the condition where the sciatic nerve gets compressed, so that there will be sharp and radiating pain will be in the lower back, from the lower back to the leg and the foot. And there are other causes of the sciatica too, that is piriformis syndrome. In piriformis syndrome, the piriformis muscle tends to compress the sciatic nerve, that leads to the sciatica. So this can be occurred due to the hip dislocations, fracture of the pelvis, so that the piriformis muscle tends to compress the sciatic nerve. So when the sciatic nerve gets compressed, it leads to the motor and sensory deficits. Okay, so these are all about the sciatic nerve. Thank you.